We're going to find the nasal bone. We're going to find that little space between the nasal bone and the frontal bone. So find that with your finger, and you can we already started here, but we started in the center. This time you're going to go on the inside. That's where we're going to begin. And then I'll show you what we're going to be doing. So we're going to find our nasal bone. We're going to be connecting the ball to the nasal bone, and we're going to stretch it away as it goes towards the ear. We do one spot under the eye. We'll do the next spot tracing the maxilla and the zygoma, and our final spot will be right under that maxilla going out to the zygoma, out into the ear. So let's begin. So if I'm on my left side in this case, again, I'm going to go from where we were in the center. I'm going to drop into that left side. I'm going to feel where there's that divot. I'm going to pinch the ball and really pinch it sort of small if you can, because that's a really small area. So I'm pinching it really small, and I'm just getting in there. So I've had to pinch with both hands. Now that I've pinched with both hands, I can just use the one. No, I lied. I need to use both. Again, my chin is tucked. The head ball is supporting your head. You're lying down, and we're breathing. Just remembering that for the purposes of this video, I am seated so that you can see the areas on the face, so it's a more detailed experience for you. From here, I'm going to go on the side of that nasal bone. So same thing, I'm pinching the ball. My head's on straight. The head ball is supporting your head. I'm going to pull the nose. In this case, I'm pulling it with my right hand, and I'm pinching the ball and I'm pressing medially. So medially refers to towards the center line of your body. So if you think of this center line, everything that goes towards it is medial. Everything that goes away from it is lateral. So let's start working in the lateral plane. So I'm going to gather up that nasal bone, not the cartilage, the nasal bone. I'm going to start to traction it away. So tractioning refers to that continuous motion. Again, chin is tucked, and with the ball, I'm stimulating the maxilla. Maxilla is connected to the zygoma, but they're two separate cheekbones. So a lot of times, we have stress, we have this and that, that cause some things that we don't really like in the bottom portion of our eyes. And of course, as we move through life, this is unavoidable, but a lot of it comes from the fact that this maxilla is compressed. So we're trying to open it up. So I keep this pressure, and then I move the ball out. And this is a bit different from the frontal bone because we do need to stretch a bit more, but we're not rolling superficially. If you do lose it, you again connect it in, traction away. I can let go of the nose. I can move the ball. Of course, I'm just showing you seated, so you are lying down. And I'll show you what it looks like on the side. So I'm moving the ball. Your head doesn't turn, your head stays straight. I'm just going towards the top of the ear. And then the last spot here at the hairline, at the top of the ear. And then this does feel really good when you can just brush it against your hair. Okay, let's go to the next spot. So it's the exact same thing, but we don't start in this little crevice. We're just going to start at the nasal bone because we're going down. So if you just think about it like 3 passes, 1, 2, and 3. So I'm going to, again, move that nasal bone, pinch the ball, press medially towards the center. Again, I'm having to readjust just because I'm in this seated position, but this is a really important thing for you to pay attention to, because if you're lying down and you're pushing, your head will definitely want to turn. Please don't succumb to that temptation. Keep your head on straight. Okay, I'm going to use my fingers to pull the nasal bone, not the cartilage, the nasal bone. And then I'm going to use the hand to stretch the ball in the direction of the ear. And we're breathing. Now we're going towards the zygoma. The zygoma is a different bone altogether. So it's the apple of your cheek. I'm connecting it and I'm tractioning it away. This is a little bit easier to do a continuous motion just because we have more meat to work with than we do on our forehead. Again, I'm going to move it out. You can see where it is. It's just where you would apply your blush. Chin is tucked the whole time. And here we go. Let's go to the center of the ear. So you're at the hairline, connect in, traction away. And just with the natural oils around here, it might feel a bit slipperier, and that's totally fine. And then we just take it out onto the head. You know that? Oh, I hope that didn't sound too bad in the mic. I'm just going to wipe off my ball. Again, you can use a towel. In this case, I'm just using my pants. Okay, here we go. Here's our last spot. So at the very last part of that nasal bone, I'm pinching it in. It's already relaxed, so you can see how much better it's responding. Now, this is where we do that sort of angry dog. So I'm going to start to gather up this tissue underneath the maxilla. I'm gathering it and I'm pushing it upwards so that you're getting this sort of angry dog look. So you're sort of setting all of this masseter tissue atop the ball. I'm going to move it out. Oh, there's the lipstick. And I'm going to press it up. Again, if you get lipstick on the ball, who cares? You can just, it will just wipe off. What you don't want to do is put the ball in a dark colored bag because the ball will take that color. Okay, so I'm at the zygoma, connect, traction away. Remember, we're going towards the earlobe. That's our destination. And if you wanted to do a second pass, because we're so tight in the masseter, rather, the masseter is this muscle, you can do another time here. Okay, so here we go. It's almost at the hairline. Same thing. It's the head is on straight. I find it at the earlobe, connecting in. And just take it out into the head. Oh, that feels so good. Let's do the other side. You can just take a moment. Maybe you feel that this side is a lot easier to breathe. It just feels a lot better. You can just kind of see the difference between the sort of bag, if you will. Okay, so remember, this is super important right here. It's that little divot. So that little divot between the frontal bone and the nasal bone. Recall that we started this whole thing in the center. We're just dropping into the side. I'm pinching it. I need to wipe it off again because obviously I'm excreting a little bit extra oil right now. So again, I'm pinching it. I'm finding that little junction here. And I'm really having to pinch because this is tiny. This little joint here is absolutely teeny, teeny, tiny. And of course, if you ever study the bones of the skull, you see how they're fused together and they look like a zigzag line fusing together. But we know from braces, even when we're adults, we understand that bones move with traction. That's all braces are. You're just applying an outward traction. So we're doing the same thing here with these bones. Okay, so let's now go into those three passes. So we go from nasal bone to maxilla to zygoma, top of the ear. That's pass number 1. Pass number 2, nasal bone, again maxilla, zygoma, middle of the ear. Last part, bottom of the nasal bone, under the maxilla, where you're really getting all that tissue, getting that angry dog out into the lobe. So here we go. I'm using my left hand in this case to pull the nasal bone laterally. And then I'm pushing, the ball medially in towards the nasal bone. I'm really pinching it. And I'm feeling everything relax. I'm going to use my left hand. I'm going to continue to pull the bone as the ball goes onto the maxilla. I can feel this moment of glorious nostril breathing. For our nervous system, nostril breathing is so very important as well. And that also keeps the integrity of the face if we do focus on nostril breathing. Okay, move it out to zygoma. Same thing, head is always on straight. Connect in, traction, again towards the top of the ear. That's where we're going. This feels so good. And it's a beautiful thing too, because you'll notice when your breath is really tense, when you've relaxed into this breath so much, when you do tense up, you'll start to notice it and then you can fix it. Okay, so here we go. We're at that zygoma, connecting in, tractioning out. Out and up. Yes, out and up. That's where we're going. And at the hairline, connect it in, traction at the top, towards the top of the ear. And I'm just going to do one more sort of final spot. Again, I felt some tightness on that right side. And then again, it's going to go towards the head, which is the nicest part. Okay, here we go. Move the nose again. Pinch the ball, press medially. So I'm pressing this hand medially towards the center of my nose. Again, this is something that you're going to practice over and over again. You will get the strength in your hands to do this so that your hands aren't tired from this. I promise, but you just have to keep at it. Okay, I'm going to move the nasal bone. I'm going to move the ball to the maxilla. And I want to feel that stretch. That chin is tucked, head is on straight. Again, we're literally creating space between the nasal bone and the maxilla bone. We can release the nose. Here we go. Move the ball out. I'm tucking the chin. Oh, and I'm lifting the ball and tractioning it in the direction of the center of the ear. Here's the next spot. Again, connect it in. This is where you would put your blush. Connect in, traction away. So by doing this, of course, we are increasing the blood flow to our face, and blood is absolutely magical. And we really need it in the face because a lot of our face muscles don't connect to bone, they connect to skin. So we really need that blood. Okay, let's go to the center of the ear, connect it in. So essentially, our goal in this work is to create space at the facial bones, to release the muscles, increase the blood flow so that our skin can be hemodrated. I enjoy that term because it's hydrated, but essentially with blood from within. And then you're going to take it out to the ear and take it out. Here's our final spot. So again, you find the bottom of that nose, pull it away, pinch the ball. You can see how repetitive this becomes. And that's what's good about this work is that once you get better at it, you can just go deeper. You don't have to think about it. Okay, Let's go under. So get it under there. You really want to look like an angry dog right here. You want to show your teeth. I'm using both hands. I'm literally sitting that cheek on the ball. I'm stimulating the bottom of the maxilla. This also helps to get some blood flow to your gums. Okay, move it out. Connect in, traction up. Before I started this work, I was threatened with expensive and painful gum surgery because my gums were receding quite a bit because I was grinding so much. And my last dental visit, they haven't receded. It's amazing. So yes, the damage has been done. It hasn't been reversed in my case, but it hasn't continued. Okay, move it up. Up and away. And I'm always going to tell you the truth. Always. Okay, connect it in, traction up. And move it to the hairline. Again, connect it in, traction up and away. Clearly, my right side really needed some little TLC. And then we're going to take it out towards the lobe, connect, and out into the head. So there are your 3 passes from nasal to maxilla to zygoma.